All right. Hello, everyone. Good afternoon and welcome to the Association for Neuropsychology Students and Trainees webinar. Today, we have four lovely panelists who are all in private practice in some capacity. And I'm really excited that they're able to join us today and tell us a little bit about their experiences, their training, and some considerations that you might want to have if you're interested in going into private practice. So here's who we have today. So I'm Allison. I'm the Professional Development Officer for ANST, and I'm a current intern at Dell Children's Medical Center, and I'll let Abel introduce himself.
Hi, everyone. My name is Abel Mathew. I'm currently a postdoc at the Children's Health Andrews Institute, and I'm currently the ANST Programming Chair.
And I'm just going to do brief introductions for all four of our panelists today, and then we'll do more in-depth introductions as each of them start to speak. So we have Connie Jacocks, Leena Mohapatra, Lori Alasantro, and Ashley Whitaker. Before we get started, if you guys have any questions throughout the presentations, you can feel free to put them in the chat either to everyone or just to me and Abel individually, and we're going to moderate the chat throughout, and we'll ask some questions from all of our panelists at the end. All right, so we're going to get started with Dr. Jacocks. So Dr. Jacocks is a board-certified clinical neuropsychologist. She received her doctoral training at the University of Miami in clinical psychology with an emphasis in health psychology and neuropsychology. Dr. Jacocks completed her predoctoral internship at the University of Chicago, postdoctoral fellowship at the Johns Hopkins University School of Medicine in rehabilitation, psychology, and neuropsychology. She was an assistant professor in the Johns Hopkins University School of Medicine from 2013 to 2015, prior to joining the staff at Craig Hospital in Denver, Colorado. At Craig Hospital, Dr. Jacocks was an attending clinical psychologist specializing in neuropsychology and rehabilitation psychology, including assessment and intervention services for patients and families experiencing traumatic brain and spinal cord injuries. Dr. Jacocks opened her private practice, Vista Neuropsychology, in December 2020, and she continues to specialize in comprehensive neuropsychological care, including assessment and intervention. Dr. Jacocks also provides medico-legal services, including forensic assessments, independent medical examinations, and capacity evaluations, including opinions on guardian and conservator. Her research interests include the integration of motivational interviewing into rehabilitation settings. Through partnerships with colleagues at Johns Hopkins and Craig Hospital, she was the founder of the Rehabilitation Engagement Collaborative, aimed at furthering these efforts, and is a co-editor of the recently published Motivational Interviewing in Medical Rehabilitation, Improving Patient Engagement and Team Function. So thank you so much, Dr. Jacocks. I'll let you take it away.
Absolutely. Thank you so much for having me. It really is fun to be a part of this. And I remember having lots of questions about private practice myself before getting into it. And so being able to have a discussion about it with people who are also wondering more about it and exploring it as an option is really great. So it's a pleasure to be a part of it. So I have just a couple slides outlining different aspects of private practice and how I got into it and some of the pros and cons. I think the general goal for me in my mind is just, at the end of all of this, that you all feel like private practice is always an option, at sort of any point during your career, and a really viable one. Everybody has different experiences with private practice, and they got into it different ways, and everyone's private practice looks different. So I'm really interested actually today too to hear from some of the other speakers and what the process has been like for them and how their practice is set up and structured. The other thing, one of the really important things I think to know is that you never have to do this process alone, that there are always people who are willing to mentor and provide information. And I was incredibly lucky to have a mentor that modeled some of this for me really early on, and has been sort of a champion along the way, letting me know that yes, you can do it, and and it's totally viable, and has just been a great support kind of at every step of the way. in terms of pros and cons, there's a ton, right? But just in general, here's a few that came to my mind. In terms of the pros, and one of the reasons that I really got into it was to have more flexibility and autonomy. On a personal note, so I have 2 kids. I've got a 5-year-old and an 8-year-old. And I got into private practice about 4 years ago. And so part of it was wanting to spend a little bit more time with them before they got into school. And now that they're in school, it's great, within my partnership, me and my husband, that one of us has some flexibility for the 10 million sports and pickups and school days off and all of those things. I also had a really poignant experience while I was working at Craig Hospital, and just to tell you a little bit about Craig, so they only do, it's moderate to severe brain injuries and spinal cord injuries, so pretty catastrophic injuries. And I had a mom tell me that this was the most time that she had spent with her daughter in years. And from me, I felt like, my gosh, like, I don't want to have to wait for something, like this to happen to actually have a little more quality time with my family. So for me, that was some of my really personal reasoning about why I wanted to explore this. From my bio, that, I've been in academic medical centers mainly, and then in Craig Hospital, there's a research arm, but was more primarily clinical. And it was all great. I loved those experiences. I loved Craig Hospital. It's an amazing place, but there was not an opportunity for me at that time to do part-time. And even if I did and I made a position, I knew I would be taking a very significant cut in terms of salary and what I was able to make. And so that was, you see the picture with the fish jumping out, that was the point for me where I decided, okay, like, let's really make a go of this. There are certainly some cons to private practice. One, it's all on you. And so there is some pressure there in terms of maintaining, income and trying to get people in the door. And then what happens when people cancel can always be a little bit stressful. For me, it ebbs and flows, and it all seems to sort of even out in the end. And so it's just trying to not stress too much if things slow down a little bit, because then it seems like it just picks back up double. But we'll talk, and I'm sure others will talk also about referral streams and how to get people in. There's financial things to think about. So in terms of, what are you going to do for health insurance? What do you do about saving for retirement? Do you have a disability plan, short or long-term disability that you're paying into? And so things to think about and arrange sort of on the front end. There's also potentially less social interaction, and feedback from peers. And, I'm a pretty social person, and so I do miss that. I do a lot of coffee with colleagues out in the community for networking, but also just to get some of that social interaction in, and for case consultation, and a lot of texts and phone calls to friends in the field, chatting about cases and catching up. So let's go to the next slide. And I didn't mark what time I started at. So I don't know, Allison. I think I have about 5 minutes left.
Yep, you're good. And I'll just shoot you a chat if we're
perfect. Thank you. So we talked a little bit about when's the best time to make the leap, and that's different for everyone. It is important to note, I did a little bit of private practice while I was at Craig. And so if you're in a position where there's actually the opportunity to do some private cases on the side, that can be a great way to kind of dip your toes in and see how it goes. You get your LLC set up, and you start thinking about maybe taking some cases on your own. And I, if it's possible, I absolutely recommend doing some of the things on the slide under preparation and setup before you make that leap. You can do some of this preparation while you're in other positions. So part of that is generating a vision of what you want your private practice to look like, how many days a week, schedule wise, what kind of patients do I want to see? You think a little bit about referral streams. I know when I left Craig, I have an address book, a professional address book, and I wrote down every name, person, of people that I felt like I wanted to keep in touch with and that might be able to refer people my way. Think about office space. So I actually lease an office from Regis. It's a company that rents office space. But it was great for getting into it because a lot of things were covered. They have a copier, right? If you need it. There's, a lot of those things were, on the equipment end, we're sort of taken care of. There's a lot of different electronic health records, therapy notes, Simple Practice. I use Simple Practice. You could run your whole practice from there, especially if you're just doing kind of the therapy or intervention side. There's billing to think about. For my practice, I don't participate in insurance plans, so it's private pay. And there's different ways that you can navigate that. There's branding and marketing. I think one of the best things that I did personally was my website. So many people are you go to Google and you search neuropsychologist Denver and they see what comes up. And I think that goes for people in the community, but also people in physicians' offices who are actually trying to find providers for their patients. So that was, I think, something that was really helpful. I continue, I did outreach other ways. I have a page of like an info sheet about me and the practice that I can send out. From that address book, I also do yearly holiday cards to thank people. It's just any way that I think you can stay sort of present in people's minds in the community can be really helpful. There's testing and supplies to think about. I bought a lot of mine used. That's probably one of the biggest expenses early on. So offsetting that any way that you can is great. And then I have some other things in place. So I do some forensic work. It's helpful to make citations and be able to cite articles. So I actually have a personal library where I keep, all the articles that I'm pulling. And then I also recently did a professional will, which essentially is what happens to my practice if something was to happen to me. So again, this is not, comprehensive by any means, but just some of the things that you want to be thinking about, as you're kind of getting set up to go. And again, none of this on your own. So don't, my biggest recommendation is don't be afraid to ask. Your colleagues are your best resources. I have asked people very specific questions about, and it can be a little bit nerve-wracking. Can you give me a range of what you're charging? And they will send me a fee schedule. It's great. When you're really working with people one-on-one, my experience has been that people are not afraid to share information, and they really want you to succeed. Listservs are your best friends. There are some incredible ones out there. One that I highly recommend is the AACN listserv. And I have learned so much from the interactions there, and everyone is just incredibly supportive and sharing. One really important question to think about as you've launched and you're expanding your practice is what is my expertise and what am I competent to do? Where do you feel most comfortable? And there's this question that arises of whether, is this a confidence issue? So it's something I can do, but it feels kind of crazy to go out on my own and actually kind of put myself out there to do it. Or is it a competence issue that I actually really need to be doing some studies, some training, some other things to get myself ready to do a new kind of eval, if that makes sense. And that can be a little bit tricky. But you can absolutely always expand competence as well, and it starts with reaching out to colleagues, doing those seminars, doing additional trainings. I wrote here this concept of personal minimum. So, it's sort of this aviation term where they need pilots think of it as, I need a certain kind of weather, I don't know, a number of parameters, right, to be in place in order to fly that day. And it's the same thing, I think, with competence. Is this individual English speaking? Are they Spanish speaking? I did a case where an individual was deaf. Again, is that something that I'm comfortable with where I should be proceeding with this evaluation, or should I be referring it out? Also, don't be afraid to say no. If it's not within your wheelhouse, that's okay. Another case will come. And one of the best things I think about private practice is you have the autonomy and control over your time. And so it is okay to say no. It is okay to set aside the time that you need. It's okay to set the schedule that you need to make this work. I never stop battling imposter syndrome. It's kind of always there, even when you're off in private practice and doing well. But I think it's a good reminder to always consult to make sure that you're on the right track. And there's lots of other great resources too. There's podcasts of the testing psychologists, some of you may know. I think they have a website and a Facebook group also. But again, you don't have to do this alone. I'm happy to be a resource for anybody here during the talk. And I think on that last slide, Allison, and you may send this out too, but I just put my email address and the website there if anybody has questions. I think that's about my time.
Awesome. Thank you so much, Dr. Jacocks. That was great, especially about the part about knowing the difference between your competence, but then also like whether it's like some insecurity about kind of doing things on your own. So I'm sure we'll get some questions about that in the Q&A session. All right, so now we're going to go on to our next presenter, who is Dr. Leena Mohapatra. So Dr. Mohapatra is the owner of NAMO LLC and an affiliate of Honolulu Psychology Collective. She completed her doctorate at the University of Miami, internship at the University of Minnesota Medical Center, and a postdoctoral fellowship in clinical neuropsychology at the Massachusetts General Hospital, Harvard Medical School. Dr. Mohapatra has broad expertise working within hospitals, schools, and community settings, conducting neuropsychological assessments and providing consultations and customized trainings about the cognitive and social emotional impact of underlying neurological conditions. In addition to her private practice, Dr. Mohapatra has worked in several hospitals. She is currently at Norton Children's Hospital in Louisville, Kentucky, and was previously at Kennedy Krieger Institute in Baltimore, Maryland. Dr. Mohapatra has been involved in training throughout her career, having trained over 20 clinical psychologists and neuropsychologists. Dr. Mohapatra is a military spouse, recent lover of dogs, and podcast enthusiast. She enjoys dancing, cooking, traveling, and geeking out about the cerebellum and genetics. And with that, we introduce Dr. Mohapatra.
Thank you. I really felt like that last part would probably resonate with others. I think it's really important to geek out about all the things that we do because it's so much fun. Hello, everyone. I'm really excited to be here with all of you today. I love being a part of training. I have a little bit of a unique experience being a military spouse, which really launched me into kind of the world of private practice. But it also launched me into a lot of experiences that have really helped shape how I think about who I am as a neuropsychologist, but also broadly speaking as a clinical psychologist. And so I will say when we moved from Baltimore, where I was at Kennedy Krieger Institute, and my husband got posted in Hawaii, most everyone was like, oh my goodness, you're so lucky, you're going to Hawaii, this is going to be great. And in my mind, I had moments of panic and I was like, what am I going to do? Hawaii is an interesting place for many reasons. Obviously, it's beautiful, but neuropsychologists, particularly in pediatrics, were not really in hospital settings. So there was the option of working in the military hospitals there, but they were kind of under a hiring freeze when we got there. And it was really hard to get into some of these hospital settings. And so I was kind of stuck and I didn't know really what to do. I was able to connect with a lot of people when I moved there. And through all sorts of connections, I actually ended up in the school system in Hawaii. And so Hawaii has a shortage of school psychologists. And so clinical psychologists often fill that role. But I was specifically hired on because the district that I worked in was like, we have all these kiddos with medical conditions, with TBIs, with epilepsy, with rare medical conditions that we just don't know how to support. It would be really helpful to have someone with your background come in. And so I decided to work in the schools for 2 years. And it was actually one of the most kind of influential things I've done, because as a pediatric neuropsychologist, or primarily pediatric neuropsychologist, we spend so much time making recommendations to schools, and I got to have this experience being actually within schools, working with school teams, helping design interventions for kids who actually had some true memory concerns, true executive function concerns. And it helped me really build rapport within the community. And so during the pandemic, I was kind of in a place where I didn't know I really enjoyed being in the schools, but I was feeling like I was really missing just doing assessments. Sometimes IEP meetings and things can be very daunting. And so I was like, I'm ready to kind of go on my own. I had done a talk for someone, and she point blank was like, why are you not in private practice? Your skill set can be used. There are a lack of neuropsychologists, particularly in pediatrics, on island. There's also a need for having providers and therapists of your particular cultural background. And it kind of was the fire I needed to really push me forward. And what I've learned kind of retrospectively in this process is that I'm so glad I did it for many reasons. And I think one of the things that we so often talk about with private practice is just the testing aspect, but your private practice is your business. And your business encompasses so many different areas of things that you might want to do. And so what I realized is I had all these things that I really enjoyed. I enjoyed doing consultations with schools. I liked some programming and development work. And I wanted to be able to do lots of different things. And private practice has actually offered me that opportunity. It's also portable. So as someone who will likely be in 2 or 3 more locations for a set period of 3 to 4 years, or I don't know, life is pretty ambiguous. I can take my business with me. And so in periods of time where we're transitioning to a new state or a new location, I have ongoing income that is coming in because I can continue to do work in various capacities because I've maintained a private practice. And so I think that, if there is anyone in this similar situation, or even if you're just thinking like, I want to be more portable in my life, right? I think this idea that we can live in different places and do the things we want to do, private practice can offer a lot of those kind of benefits. So really thinking about your life circumstances, your why, as why you might need to go into it or why you might want to go into it, is a really thoughtful exercise, I think, to have. The when piece is always hard. Some of us transition slowly, some of us take our time to transition into it. There are so many different ways to navigate having a private practice. And I think it all depends, once again, on your life circumstance. I think what is nice, if you have the privilege of time, is to just think about this roadmap. What is a time point I'd like to start going into this? When will I feel like I have, some income to help kind of fund my private practice? And so really sitting and thinking about when in the next couple of years you'd like to is a good way to kind of start thinking. The with whom is always kind of an interesting thing, because I think a lot of people can go into private practice and be on their own. I crave social interaction. I realized during the pandemic, when I first started my practice and not many people were coming into the clinic setting, I would go talk to the barista at the coffee shop because I needed to have, some engagement. And so knowing that's who I was, I actually ended up joining a group practice, but it wasn't a neuropsychology practice. There were other neuropsychology practices that I had considered joining, but because of circumstances around the pandemic, I wasn't going to be able to kind of share office space at, the number of days that I wanted to. So I actually joined a practice where the 2 main founders had been in Hawaii for a really long time. They had strong community ties. I realized from a value standpoint, I really jived with them in terms of that. And honestly, I really liked them and I liked their model. Some people were employees of their practice, which was the Honolulu Psychology Collective. And some of us were affiliates where you pay a fee and you get some of the benefits of billing supports, insurance, credentialing. but the rest of it was your practice. And so that was a nice balance for me, where I knew I could set up what was my practice with other people. And the best part of it as kind of a neuropsychologist, I feel like I'm always looking for people to help provide therapeutic supports. And I had a group of people who I could, refer my patients out to, which allowed for a good continuity of care. In this setting, they also had educational advocates who had worked with this group as well. So for me, once again, it kind of lended well to what I wanted to do. And so I had people who I could reach out to for advocacy, educational supports. And so when I started to think of the layers of what I need to help support my patients from a clinical assessment perspective, it was a good place for me to kind of be. But there were plenty of options. And I think knowing that there's so many different constellations that you can actually think of. Some people go into group practices where everyone is a separate employer. Sometimes you have an employer and then you are in a private practice setting where you are the employee. There's different ways to do this. So it doesn't have to be, I need to jump and go into my own setting on my own. You can think of these gradual ways of kind of progressing through the private practice world if that's something that's of interest to you. When I was at Kennedy Krieger Institute, I used to do a kind of a professional development seminar on branding. And branding and marketing are two different things that we sometimes don't always think about. But branding is really kind of what you are going into the situation with. Like, who are you? What are you selling? And I took a lot of time actually and just kind of thought about, like, what are the values I have? Who are the people I want to be kind of affiliated with? What does my logo say to people? And I actually, from a marketing perspective, I didn't have to do as much marketing because I had these kind of connections and links that I had made in the community. So I don't have a website yet. It's still in the works, but I did post on Psychology. Psychology Today. And I had a profile, and that was a great way actually for people to come and find me, because I could write a blurb about myself and my values and what I wanted out of people coming in to see me. And that was a good way to kind of brand myself and market. You can go to the next slide. Thank you. So I think about when I was thinking about, you have to consider who your team is. Like, how are you going to put all these people together? Legal is something that you don't necessarily need. Like, doing the paperwork for starting your business doesn't always have to require someone who has a legal background. But I think having some legal resources can be really helpful. In my experience, I've had to make some contracts for specific cases and specific families, and it's been really helpful to have someone who is a contract lawyer go through my contracts and actually kind of just vet to make sure that they would stand up in court, should that be the case. If you need people to help with your marketing and branding, admin teams, your professional team, which is like your related services, other providers you can consult with. And then I really think it's important to have mental health support. And this can be for a wide range of reasons, right? These can be good friends that you talk to. This could be, professional executive coaches. It could be a therapist. Because I think one of the things about jumping into a private practice that I think I was really excited about, but didn't quite realize, is that it's really easy to say yes to a lot of things as you're starting, because you really want to get yourself up and running. And sometimes that is an exhausting process. And what can happen is that the desire to say yes and support and help your community will also result in you feeling overworked. And private practice, compared to the kind of hospital setting, is very different, because there were things I didn't anticipate in a private practice setting that I realized that hospital settings kind of shielded me from. And so the legal pieces, when people send subpoenas to you, like when you're in an academic medical setting, someone is there to help navigate all of that for you. So you may never see anything. Whereas when you're in your own private practice setting, that's directly coming to you. And so the time it takes to navigate some of those subpoenas, when do I have to respond? How do I respond to these different things? In private practice settings, I think I don't know if it's just kind of the nature of where I was or what it was, I had a lot of high conflict families that would come into my office. So I had probably some unique situations where it completely drained me having to deal with a lot of those family conflicts. And so I needed a lot of downtime after that, but I never did a good job in the beginning of planning for that downtime, like giving myself that extra time to really be like, okay, I need to take a break for a little while. These things have been exhausting. I've been really pushing myself to work towards these things. And so whatever that mental health self-care support looks like, I think it should be kind of at the forefront of thinking about who your team is and what are the kind of supports and things you want to have on hand. As I said, Hawaii was interesting because there wasn't a lot of neuropsychologists in hospital settings. And so my referrals initially, I actually didn't start my practice until I had about 8 or 9 referrals already kind of waiting. And then once I started, I knew that was about a month and a half worth of clientele for me. And then from there on out, it kind of streamed in. I feel like because there is such a high need where I was, and I think that's something to consider, is if you're in a high need area versus kind of a lower need area, high need areas will inundate you. I had no problems with kind of filling up my private practice. I was booked within 2 months and kind of at a full capacity. And people told me that I needed to have like, therapy clients to also kind of consider just to kind of buffer the growing phase, but that wasn't the case for where I was in Hawaii. And so I think getting a really good sense of what that what the community referral stream looks like is really helpful for you to gauge what your startup process is going to look like. I think because I had made connections and because I worked in the schools, I was still actually getting contracted by the schools to do some of their cases as well, particularly some of the more medical cases, questions of like regression in skills, pauses in learning development, the medical cases that were more complex. And so that was already kind of in place as well. So I think, if you have the opportunity to be in a place and kind of really build some connections in the community, it does help that referral stream as you kind of leave the setting and helps provide what you need in terms of supporting your private practice. As I said, people told me I needed to really go in to do some therapy, and I, as a neuropsychologist who had primarily only done assessments, I really thought I was never going to do therapy again. But I ended up doing some, and actually it's been really, really wonderful because I've been able to kind of broaden some of the skills and because I was in a practice where a lot of people were doing therapy, some of the things that had initially interested me when I went into grad school, when I initially thought I would just purely be doing therapy, I was able to kind of go back to and be able to do some of those things that I think were restricted for me in other settings, particularly those academic medical settings. And you get to kind of decide what your balance is going to look like, which is really nice. And I think that's something to consider. What are the things that you want to do? What are the things that are going to fill your cup and really help you? Next slide. And then how much to budget? There's a lot of things to budget for, and the financial part is always the toughest one. But one of the pieces of advice I got after I started my private practice was to really think actually what you need to kind of live your life. Like what is kind of the income you're comfortable with? Think about the cost of these things, how you can, as Dr. Jacocks said earlier, if you can get test equipment that is used, that can be helpful. And then kind of work your way from there to think about what else, like how many patients you might need to see to really kind of meet the demands or meet your basic needs. And then everything that happens that's above that is kind of exciting, right? That's added income. And so if you can think of that reverse budgeting method, I think it can be really helpful as you start, because there's a lot of things to think about. Test equipment is definitely one of the most expensive things, but it's necessary. We can't do our jobs without it. And then insurance versus private pay. I went the insurance route, and I pretty much only took insurance with some private pay. I think now having left Hawaii and kind of rethinking the what I want my private practice to look like now and also in the future, I might take less insurance insurance and think about more sliding scale and different ways of kind of thinking about cost, because insurance it's a lot of work when you're a person doing all of your billing only. If you don't have that admin support, it's a lot to do on your own to kind of manage and navigate, particularly when someone doesn't pay, and trying to figure out how to navigate that is a lot of extra time. And then finally, so last slide, you know, just remember, like, it's okay to make mistakes. I think we know a lot of us who are neuropsychologists you know, we do our job really well because we don't make a lot of mistakes. But in this private practice world, things happen. As Dr. Jacocks said earlier, like, ask for help. It's completely okay. I had a lot of people to go to. I still have a lot of people I reach out to for case consultations, for that emotional support when you've had a stream of referrals where you're like, I don't know why this is happening. I just need to kind of vent about this a bit. It's really okay to delegate. I did not do a good job of this in the beginning, and this is what actually probably created a lot of burnout for me. And I think I learned that a little bit as I pushed through the private practice, but I wish I had delegated more in the beginning because there was a lot of things I didn't need to do, and I should have just let other people do that. But also have fun. I think private practice has been this like really beautiful experience of kind of finding what I really love to do. I have done military contracts or Department of Defense contracts in this process, having different contracts with different entities, but still using my skills as a psychologist, as a neuropsychologist, and getting into more applied work as well. Like, I contract with the Department of Ed in Hawaii still, and we're working on creating, you know, things like metrics for executive function milestones in kids to help really with the programming of IEPs. That to me is super exciting because it gets to use all the skills that I use on a regular basis in a bigger sense. So I think this process can be really fun if you're able to kind of go with the flow and just like take those opportunities and be excited about it. Thank you guys. You know, if you have any questions, you can send my contact information out. I'm happy to answer any questions anyone may have, and hopefully some of this was helpful to someone.
Thank you so much, Dr. Mohapatra. That was great. I think it's nice to think about, sometimes you don't choose the private practice life, sometimes the private practice life chooses you, but you're still able to, you know, make it work for yourself. And I'm glad that it ended up being like really beneficial for you long term. So next up, we have Dr. Alasantro. So Dr. Alasantro is a board certified licensed clinical neuropsychologist. She completed her undergraduate degree in psychology from Virginia Commonwealth University. She went on to obtain a Ph.D. in clinical psychology with neuropsychology specialization from the APA accredited doctoral program at the San Diego State University, UCSD Joint Doctoral Program in Clinical Psychology. In 2012, she was awarded a competitive NIMH-funded T32 Biological Psychiatry and Neuroscience Fellowship at UCSD. Following her fellowship, she worked as a staff psychologist at the VA SDHS in a residential treatment facility for homeless veterans with histories of PTSD and TBI. Dr. Alasantro joined the Neurology Center of Southern California in January 2016. She provides comprehensive neuropsychological evaluations for adults with dementia, movement disorders, traumatic brain injury, and stroke, as well as other medical and psychiatric conditions. In addition, she provides pre-surgical evaluations for deep brain stimulation surgery and behavioral interventions for cognitive deficits and psychological disorders. In addition to her clinical expertise, Dr. Alasantro remains active in research. She has 22 peer-reviewed publications and 2 book chapters, and she's presented research at numerous national and international conferences. So welcome, Dr. Alasantro. Thank you so much for joining us. And I'm going to unshare screen so that we can all see each other.
Well, wonderful, because I am the one person that did not create slides, apparently.
You're not the only one.
All right, good. So, you know, I think one question that really resonated with me initially was like, well, did you ever want to work in private practice? And the answer was really, it never really crossed my mind. It was never sort of top of the list. I had written a grant. I was working at the VA, and it was an extremely stressful residential position to be in, very demanding. And I had written a grant, and the idea was, okay, I'm going to write this VA funded grant. I'm going to transition from my clinical role. I'm going to step into a research role. And the VA wouldn't review it because there was a URL in it, and just basically a link to a website. And it kind of really deflated me. And around this time of being deflated with my clinical work and feeling deflated with research, a colleague of mine had reached out and said, hey, I have this private practice, this group that I'm working with. I've been here about 6 months. I'm inundated already. They want to hire another neuropsychologist. What do you think? So I him and hawed a lot. I reached out to all of my colleagues at UCSD, and they were, very supportive, of course. And I just decided to take the leap. This is obviously a little bit different from the 2 prior experiences, because I work for a very large private practice. So in a sense, I feel private practice, but I don't necessarily really feel that way, because I work with 20 other neurologists. There's 3 neuropsychologists here. We have nurse practitioners and physician's assistants. And so it is absolutely its own entity. So I never feel alone. That's a great part about my role here is that I have a neuropsychologist sitting next door to me. I have a neurologist I can walk down the hall and speak to. We have a research department where we have over 13 clinical trials going on. So I maintain involvement with those clinical trials. I have my own IRB where I look at clinical data, which we have a lot of. So it certainly is a unique situation. We have billing, we have scheduling, I have somebody doing credentialing. And so, but, I pay for that as well, in a sense. So I have a salary, and it's basically, I have a base salary with production bonus. And so depending on what I bring in, I get a bonus every month. And so it's nice. I don't have to worry about a lot of those logistics. But again, at the end of the day, maybe I could potentially make more money if I was doing it all on my own. Maybe I would see less patients. I think in some ways it would work itself out, but I really have enjoyed this environment. It has been a nice transition from a more academic setting to a private practice. And I don't know where I would see myself in the next 10 or 15 years. Maybe it would be a little bit more like hanging my own shingle and kind of doing my own thing, but it certainly has been a really wonderful experience. It's hard to get this type of experience in a PhD program, even in internship, even in postdocs. I know at least through UCSD, I've tried to set up a training program here. I'm like, hey, I'm a former grad. I'm right down the street. Let's get some trainees here. This is a great opportunity for everyone. And they just don't contract like that. So they'll contract with the VA or with Rady Children's Hospital or a larger organization, but they won't sit down and negotiate these kind of smaller deals. And it's really even hard. We do mostly insurance-based. Even in that context, to get reimbursed for a trainee's work is pretty much impossible. So you really would have to be kind of a private pay setup type of a situation. And the way in which this sort of the position came about essentially was a little bit through word of mouth initially from my first colleague that sort of set this up. I've had a similar friend go through a very similar process where she basically reached out to a neurology practice and said, hey, I'm in the area. I'm a neuropsychologist. Do you think you guys would need a neuropsychologist to be incorporated with your practice? Went to work for them for a little bit and then decided, this is probably not the best setup. I'm going to do my own thing. I'm going to maintain the neurology practice as my primary referral source, but I'm going to be in a separate entity. The way in which it worked out for myself and my 2 other colleagues is it very much they want us here. They love having neuropsychology integrated. And so it's just been a really a great setup for us. And so it certainly, I don't think sometimes you got to create these situations. And I think where you're going, know who the neurologists are, reach out to them, see if there might be of interest there, because I can tell you that now that we're established in this large practice, they really feel that we are essential now. You know, we might not be making the most money. We certainly don't pull in all the big bucks, but we are absolutely integral to their patient care. And they can say to other organizations, we have neuropsychology here. We've got fast turnaround. We work directly with our neuropsychologist. They love us, and so it's really been a great setup. Our primary referral source is obviously the neurologist, the nurse practitioners within the practice, but we certainly get referrals from primary care providers within the community. And so we still do outreach to them. We will have a lunch, we'll go talk, we'll talk about the services that we offer. And so we do see direct referrals from primary care physicians as well. I do hold privileges at several other hospitals. We've done a little bit less of going into hospitals since COVID, but predominantly these were setups where we would do bedside assessments for acute rehabilitation patients. And so we may go in, do an assessment, provide a little bit of information on is it okay to discharge? What level of support are they going to need at discharge? And then we'll eventually see that person a couple months down the road for a more full-time sort of full assessment. But again, we do a lot less of that more recently. I do have a position at UCSD. It's a volunteer position. I've actually just stopped that position. It's really hard to sometimes maintain those academic affiliations. You know, a volunteer position may require you 15 hours of teaching and training that nobody's going to reimburse you for. And so eventually you've got to figure out, is it worth my time? Am I capable of establishing that set of hours that they need or the criteria that they need in order to maintain that affiliation, and how much that affiliation might be worth it to you or not worth it to you? So I just actually ended my affiliation with UCSD. What else do I want to say here? I think one of the really nice things though is flexibility. You know, when I was working within the VA system, you don't really have much wiggle room, right? They're being counters. You got to be there for your amount of time, and you are unable to sort of set your own schedule. And it certainly has been really nice to step into a much more flexible schedule. I do have 2 young kids as well. And somebody told me this really kind of depressing statistic not too long ago, which is by the time your kids are 11 or 12, you'll have spent 75% of the time you're ever going to have spent with them throughout their entire life. So Dr. Jacocks, if you want another reason to be doing private practice, there you go. It really affords the opportunity to have a little bit more flexibility in your life and in your schedule, and certainly I think is worth potentially the loss of benefits that you might get by functioning on your own versus being in a larger institution. Because this still is, even though it is a large practice, it still is sort of a private practice setting. Let's see here. Most of our reimbursements are from Medicare or Medicaid. That's switched up a little bit in California because of what they're doing here. Now it's mostly commercial insurance companies that we're getting reimbursed by. But I don't have a whole lot else I wanted to say in terms of how I ended up here. I think probably more will come up in the Q&A section, and I'm happy to take any specific questions that are directed to more of this type of setting when we get to that point. So.
Awesome. Thank you so much, Dr. Alasantro. I think the aspect of you describing how important building rapport and outreach and like showing within a multidisciplinary team that value added that neuropsychologists have is awesome. And so, yeah, I think that's great. All right.
And then we'll move on to the Q&A portion. Also, before we get started on the Q&A portion, I'm going to drop a link to a post-webinar survey in the chat. And so if any attendees would fill that out, that really helps us know what kind of programming you're all looking for. So please fill that out after the webinar. Abel, do you want to go ahead and ask the first question while I'm doing that?
Yeah, absolutely. And if y'all just want to go ahead and send me questions directly too, I'm happy to take live questions as well. This first question is, how was the process of building referrals? How much time did it take? And what methods did or did you not decide to use? And then also, how do you maintain your referral streams? I know that was kind of touched on, but yeah, any of those, and anybody can feel free to answer that.
I guess I'll go first and I'll say like two things, and then some others can absolutely jump in too. For me, I definitely started, some of my first referral streams were coming from where I had been working before. So reaching out to the physicians, that I was close with, the other neuropsychologists that are there, say, hey, please keep me in mind. If you have patients coming through, and I do both testing and therapy. So for either of those things, I will say, sometimes people find you. And so I do some work for I do independent medical exams for a company that found me. I think either, I'm not exactly sure, but I think through either the website or one of the directories online. I do some work with retired NFL players, the same thing, that they, went to, I think, the ABAP, directory. And so that was actually really surprising and kind of nice, and obviously you just get these calls. Maintaining referrals, I think, has to do with, obviously, and I need to do a better job at this, but always wrapping back around, having conversations with the referral sources. And again, just remaining, at the front of their minds, which I think I mentioned before, whether it's through emails, phone calls, coffee, cards, anything. So it takes a little bit of work, but it hasn't been actually too overwhelming. You do have to ride, as Dr. Whitaker was saying, those ups and downs, and I tend to panic a little too. And so it's a good exercise in doing some anxiety management during the slower times, but it all seems to even out.
I will say, as a more pediatric neuropsychology, what I thought was interesting is it was actually a lot harder to get the more medical referrals, the things that we're actually trained to do and the things that we do. It took a lot more work. And actually, it was towards the end of being in Hawaii where I started to finally get the oncology referrals from the hospital. And so as I was heading out, which was unfortunate, but a lot of it was just maintaining contact until, they could really kind of provide that crossover care, because some of those patients who were in the hospital were the ones who were on Medicaid, Medicare types of programs for insurance and weren't going to be able to. I wasn't taking their insurance and they weren't going to be able to. But I think a lot of it was just really broadening connections, like having other neuropsychologists connect me. But actually, once I left Kennedy Krieger Institute and we moved to Hawaii, I actually asked my old colleagues if they knew anyone in Hawaii, and that just kind of created this like network, which was really lovely. So it allowed me to find developmental pediatricians who were previously at Kennedy Krieger, now in Hawaii, and I was able to connect with them. So a lot of it was like asking, networking, and then just, being able to kind of showcase what you can do. And as Dr. Jacocks said, kind of coming back to them and letting them know, here's what you requested. And it seemed to work well.
Yeah, I absolutely agree. It's reconnecting with the referral source, making sure they were able to access your report. I think also doing feedback with patients. We try to do feedback with everybody that we see, and that's actually not necessarily standard of care, but you reconnecting with the patient, talking with them about the results, they're going to be and feel heard and feel knowledgeable about the assessment. They're going to communicate that with the referring provider. So I think feedback with the patient, reconnecting with the initial referral source is actually super important. And then just outreach with other local medical providers. So, dropping off cards, bringing coffee, doing that sort of thing can really help.
Yeah, and I haven't done much, obviously, but one thing that I have done that has helped is I've provided some in-services or didactics to some of the surrounding practices. So there's a therapy practice close by, and I've gone and I've talked to their clinicians about autism evaluation, ADHD evaluation. And so that kind of, I stay in the forefront of their mind, and then I'm the first person they think of when they have a kid who, you know, maybe has a symptom that I described.
Thanks, everyone. We got a ton of questions about billing, insurance reimbursement, fee schedules. Do you provide a super bill, all that kind of stuff? And I know some of you touched on that, which is great. I'm wondering kind of more broadly, where did you go to figure that out? Like, what resources did you use? Do you have any recommendations for trainees, like how they can learn about some of those things?
I'm pretty useless here. I'm in a situation where the billing and stuff is taken care of. I mean, we still worry about it. I still look at numbers, but part of my income goes towards that. So if that's something you're petrified of, then maybe looking into a larger practice and joining, that might be a good setup. But sorry, I don't have much else to say.
Colleagues. I emailed colleagues and have said, can you send me, and I'll say, can you send me like a template of your fee schedule? And they send me their fee schedule. But it's really helpful, especially if you're doing like forensic or medical legal work too, because there's different letters and sort of contracts that you enter into. And so having something to go off of, again, I don't think you ever have to reinvent the wheel, right? It's just seeing what other people are doing. And that's been incredibly helpful. Oh, and I will say there are some, so I'm not as familiar with it, but so Simple Practice, the program that I use, will actually do some of the billing piece for you. And then you can hire separately billing assistants also. And I know some people do that. And I think it's, it may not be cheap, but I think it's probably potentially worth it in the end. Other people may have more input or insights on that part.
Yeah, I was gonna say I ended up, because I took primarily insurance, and I had someone in the collective that I worked with who did some of my billing, but as I moved, I ended up doing some of my own and realized it was actually super easy with some of the new programs. And so I use Simple Practice as well in my practice. Billing insurance, once you get it all set up through their system, you can easily kind of create your bills after you see your patient and submit them. And so they have made ways to kind of streamline it. I think the more challenging part is clearly when you get denied for some reason and then trying to figure out how to figure out those denials. And what I did is, even though the others in my practice were mostly therapy, denials are denials. And so I would sit with the admin person who did a lot of their billing and just kind of get more information. And I was on our Hawaii psychological listserv, and so there were people who were billers who were also on there, and people would reach out to them and ask them for help and support, or even contract out with them. So that was a good way to like see who else was there who weren't just psychologists who could help with some of the billing pieces.
Awesome. I think we have a few follow-up billing related questions. So Allison, I'm just going to kind of straight fire them and we'll see how they go. So a lot of these, I'm sure, is it depends, right? So a question was in regards to insurance paneling. What does that process look like? How do you go about doing that?
I'll take that one. It is, give yourself time. Some insurance paneling took me 6 to 7 months. Some people were waiting up to a year to get paneled on insurances. And these were some of the larger commercial ones. And so not even talking about the ones that were kind of a part of Medicaid, Medicare systems. And so some of it I got invited to be on 1 or 2 panels, and that actually helped. So Aloha Care was one of our Medicare, Medicaid based insurance companies, and they they kind of requested, and because they requested me to be on their panel, they actually made it a lot easier for me to get paneled quickly. But I think for paneling, you need a lot of time for it. It's usually, if you know what your major insurance providers are in the area, starting with the bigger ones is really helpful because they usually have a lot of paperwork that you will start to prepare as part of that process, and that becomes easy. But I think a lot of it is a waiting game with them. Once you put in your paperwork, and the websites usually they're pretty detailed, pretty easy to find how to fill out the paperwork and what you need. But it's the waiting game that's the harder part. So once they actually accept it and they panel you, then you have to kind of go back and forth with documentations and signing to actually become part of their panel, which can take a month after they credentialed you. And then it can take a while for the billing part to get started with them. So there's these lag periods with insurance companies that you have to kind of keep in mind as you're starting your practice. The other option is there are people out there who will do your credentialing. So I did the major one first, and then I had someone else do the rest of them for me, and just to make kind of life easier.
Yeah, it really speaks to like the delegation piece, right? And kind of what's valuable in your time. In addition to that, if someone's joining a private practice and they're wanting to know about overhead costs, what is an appropriate percentage? 50-50, 60-40? What do you typically negotiate? What would be kind of your guidance or your recommendation to new trainees, but then also maybe even established practitioners who are trying to get into private practice?
I don't have a great answer here, except to say that I've considered what my private practice might look like in the future and how would I bring people in potentially. And so I don't have exact numbers, but in that process of trying to envision, what the future might look like, I've reached out to colleagues who have larger practices and had conversations with them. And it was very helpful about different models. So whether someone's coming in salaried, whether someone's coming in and it's a percentage of revenue, those types of things. So I think reaching out to others with similar, you want your practice to look like this, reaching out to someone with a similar model can be helpful.
All right. We had a question also about startup costs. So kind of generally wondering, how long did it take before your practice was solvent, especially knowing that buying test materials is very expensive? And then along the lines of test materials, do you ever feel like you're more limited in your evaluations when you don't have access to like a really huge battery since you're paying for everything yourself?
I would recommend buying. What I ended up doing was I ended up using Q Interactive for my practice. And so when you sign up with Q Interactive, there's a number of tests that come with it that kind of help start parts of it. And so I took assessments that were maybe a bit more kind of simple, more ADHD, LD assessments really in the beginning, just because that's what I had. And then as I built my income, I slowly added more and more assessment tools onto my docket. And I think that kind of knowing that you don't have to buy everything at once, it does help reduce some of the stress and the financial costs associated with it. I would say that sometimes I do feel limited. Like there are things that I can use in my academic medical setting for my kiddos who are more lower functioning that I just didn't have in a private practice setting, mainly because I don't see as many of those types of kiddos. But when those kiddos came up and I knew there was a better test for this, sometimes that was frustrating, but it is one of the limitations you can discuss. And we are neuropsychologists. We know how to find kind of different assessment tools, at least qualitatively discuss these things if we need to, and then refer onwards if that is the case as well.
Yeah, I think I spent about $10,000 on measures at the beginning to make sure that I had like I also did QI active. That included like my iPads that I needed and all of that. And then I kind of took the approach that as I was seeing patients, because I see them over several days, So the first day, if there was a measure that I was like, I think I really need for this patient, then I used part of that income that I was getting from that patient to buy that measure. And so I've kind of added on, I'd say, every couple months I'm adding a few more measures, and it's expanding. So a lot of them are virtual too. So I find that I can like very quickly add on through either Q Global, PAR, WPS, at least questionnaires are really easy to add on and as you need them. And then a lot of the actual physical kits, those were the ones that I started with. So.
Perfect. How do you balance clinical versus medical legal cases? Some of these require different amounts of work in these situations. So how do y'all balance that in your day to day?
I don't know that I do. I mean, I think that, so I see both. So I do the clinical and the medical legal side. It's just I guess I do in terms of the planning and planning ahead, knowing that the medical legal ones, there's record review that I'm going to need to do, right, the week before that. It may take a little bit longer on the back end. I kind of, the way I have my schedule, I have openings on it, and I tend to just plug people in kind of regardless. But there are times where, again, having the flexibility, which is nice, where I block off time. I block off writing time. If I know that, I've got, this many weeks, all that are, I'm getting a patient each week or whatever it is. And again, I'm right now I'm doing 4 days. But if I feel like I'm pretty busy, I need some time, then I just block it off. And you get to know a little bit kind of how much, you get a better idea. There's always outliers, but a better idea of how much time you'll need to pull a case together. And then I just sort of plan for it schedule wise.
Yeah, I see a couple of forensic cases, but it will be, if I have enough time, I'll accept it. And if I'm too busy, I'll just say, go to this colleague or, refer them on. But yeah. And then if I overwhelm myself, then I'll be like, okay, clear my clinic schedule. I need to reschedule that person. I need a day, and I'll kind of move stuff around. But I don't do a ton of med legal at this point.
That's a really good point too. I think that, yes, sometimes if it's, and they'll call you, they'll say, hey, I need this in 3 weeks, and you have to say no. And it's know that it's okay to do that. And refer on. I always try and give resources to other colleagues. Yeah.
All right, we are almost out of time. So I have one final question that should be like quick fire. So what is one kind of foundational book or article that you think all neuropsychologists in training or early career neuropsychologists should read?
I really like Feedback That Sticks, but that was my rec.
Is that Karen Postal? Feedback That she also does one for forensic work. That's really great.
Testimony That Sticks. Yep.
Beautiful. Yeah. I don't know. I can't think of just one, but I know that as I've taken on new cases, I've gotten a lot of texts, whether it's about testimony or somatic symptom disorders or different things.
Anyone else? Any other great books? We've had recommendations for the Stuckey board review book before, which is probably pretty dry, but important.
100%.
Yeah,
That's a great one also. Sorry, I was thinking more specific, to private practice, but absolutely.
Yeah, I think in private practice, I think one of the things that certainly stuck with me when it was said was that it's the variety is amazing. I mean, you could see a wide variety of patient populations, and and that's the good and the bad, right? Because you're always learning, you're always taking new courses, or what CE do I need to take here? What do I need to become more competent in? And so it's, you know, the wonderful thing about our job is that we kind of do the same thing every day, but the person sitting in front of us is different. And that's what keeps it rewarding and challenging. And so I think, you know, I do research and read up on whatever it is that I'm going to be walking into the office to see that day, and sort of maintaining CEs and going to conferences and doing those types of things is extremely important. And so, yeah.
We do have one really quick final question. Would you guys recommend getting board certified before going into private practice? See lots of nods.
I think it's helped. I think it's helped me with my referrals a lot by being able to say I'm a board certified neuropsychologist, and this is what that means. So
I wish I had finished it before I went into private practice, because private practice does take a lot of your time. So I was like halfway through, but it took up so much of my time, and it wasn't quite the caseload. I wasn't there yet with what I would want to showcase for boards. And so I really wish I had finished it beforehand.
I also think it might be a little easier to have the samples that are the typical ones that the board, you know, that ABCN expects if you're in a medical setting. I know I have colleagues in private practice who went straight to private practice after fellowship and had a much harder time trying to select samples. I just think it's a little bit more driven towards a medical lens.
I felt like board certification was wonderful just in terms of the review that it sort of forces you to do. And so I think that was really helpful. And, you know, and on the back end, I do think that there's some referral sources that have to have, that specify that it be a board certified neuropsychologist. And so that can be a little bit helpful sometimes.
I think an important thing to do is when you're in internship or postdoc is just get licensed right away. Don't put that off. I mean, because you might have the idea that you're going to be in research or that you're going to go down that path, but being licensed as soon as you can really sets you up to kind of pivot if you need to. And then, you know, I think board certification, yeah, the sooner the better. You do need those samples. You do need to have time to study, but I'm just glad it's over. In terms of time frame, you know, I was like 7 months pregnant, and I was, you know, in the oral defense, and I'm like, if I don't pass this, I don't know when I'll ever do this again. So maybe the kid thing was more pressing to me, but I think if you get licensed, if you know, set yourself up for getting the hours and the samples you need for board certification, you can check those off along the way. I wouldn't say don't let it keep you from doing it. The sooner you get it done, the better. But yeah.
All right. Well, thank you so much. We're over time, so I won't take any more of our panelists' time, but thank you all so much for being here today. We really appreciate it. And attendees, if you'll remember to fill out that post-webinar survey, that will be really helpful for us. All right. Thank you all.
Thank you.